Jessica has come in at me with a question. What are the reason for drains? Are they common after an uplift with implants? Oh, right, there you go. Mum of three. There you go. Mum of three's asking about uplifting implant, and so is Jessica. So thank you so much. It's something I'm seriously considering. Yeah, go for it, Mum of three. The other thing I would say to you, Mum of three, is that not everyone does it. A breast lift with implants. People stage it, and the reason for that is because of the high complication rate. So you might find some surgeons will not offer it and will only stage it. Doesn't mean they're bad surgeons. Well, it may be they're bad. That in itself won't mean they're bad surgeons, and it doesn't mean that they're not sort of capable of it. A lot of very good surgeons who are capable of it don't do it because it's got a higher complication rate than when you split it, when you do either the lift or the implants, and then follow up with the other operation for 4 to 6 months later. But I do it, but I always warn people it has got a high. Yeah, I do. Yeah, I do it as a one stage, but I do say it's got a high complication rate. And if one of the things is an overriding thing, like for instance, if it's a shape and the size isn't too bad, I say, why don't we do the lift and see what it looks like, and then you might not need implants. Or if it's the size and the shape's not too bad, I say, well, why don't we do implants, see what you think, and if the shape's not right, we can always do a lift later. So I do, talk to people about potentially staging it. But if you're like sure that you want a lift and implants, then I do it as a one-op, one stage. And yeah, I warn people it's a complication rate. Jessica on the old Facebook has asked about drains. So no. Well, are they common after an uplift with implants? I don't know about the world, Jessica, but I don't tend to use drains after a breast lift with implants. As a general rule, in terms of plastic surgery, I'm not sure about other surgery, but certainly plastic surgery, you're moving away from drains. We used to use drains a lot more than we used to. We used to use drains a lot more than we used to. Does that make sense? We used to use drains a lot more, full stop, I think would be the proper way of saying that. So that than we do now, maybe. Anyway, so I think we are moving away from it. I do sometimes use drains in the breast, really for a big breast reduction and for a capsulectomy. Those are the ops that I would use it. So a breast lift with implants, I would tend not to. So in answer to your question, what is the reason for drains? Well, the reason for drains is that when there's a space there, the drains will drain that space. So they're negative pressure, they're suction drains, and they drain the space. So they drain any fluid that might collect in that space, which is a good thing, particularly if there's a big space. Now, the thing about a breast lift is that the space isn't that big because you sort of close it down. So it's not that big a space. And the downside of drains is that there's a portal for infection from the outside world to the implant. So if you are going to use a drain, try and use it for like a minimum amount of time. Also, they're uncomfortable. Drains are uncomfortable, so patients don't like them. Also, sometimes you find the drains can actually irritate the tissues and cause it to sort of ooze a bit more, cause it to drain a bit more. Now, one of the big things we used to use, one of the main reasons that I've stopped using them, and one of the main reasons that that we used to use them, was we were worried about haematoma. Haematoma is blood collecting inside it, all ballooning up, and you have to go back to theatre. But they've done some quite good studies now where they've done a drain on one side and not on the other side, and they've shown that the presence of a drain will not stop a haematoma. So that is not really a reason to use it. So if you have a breast lift with implants and you get haematoma, and then you have the haematoma washed out, and you might think, oh, there you go, yeah, we should have had a drain. Not necessarily. So the presence of a drain will not necessarily stop a haematoma. If it's going to bleed to the degree of giving you a haematoma, that's going to happen. The presence of the drain is not going to stop that. So that's no longer a reason for them. So the main reason is just to close down the space. And as I say, I don't tend to use them for many operations except for the capsulectomy, big breast reductions. Well, that's it really for the breast, and then tummy tucks in the tummy. I do use them.